Hello and what's up, beautiful people? It's your truth, Dr. Maureen here. Welcome back again to my YouTube channel. All we do is talk matters oral health, and it is simply because I believe everybody is entitled to good oral health status. And guys, I'm super excited because officially we get to start celebrating our oral health week. And even as we look forward to celebrate the actual oral health day, which is on the 20th of this month, our theme for this year's campaign is Be Proud of Your Mouth. So, if you happen to look inside your mouth in front of a mirror, are you going to be proud of your mouth? Anyway, it's never too early or too late to start looking after your mouth. Your body is gonna thank you for sure. So, in today's video, I want us to talk about deep cleaning, also known as full mouth scaling. Honestly, this is one of those dental procedures that most of you have various assumptions. And in today's video, I will try and address some of those assumptions. So, full mouth scaling by itself is that type of cleaning that is usually done by a qualified oral health practitioner, majorly to prevent you from getting gum or periodontal diseases. However, we also do the cleaning, the deep cleaning, because proper cleaning and even flossing alone ain't enough. But then there are also some aggravating factors that might prompt your oral health caregiver to advise you to get the cleaning done. For instance, if you have visible tartar attached to your teeth, if you have some stains, which we usually refer to as extrinsic stains, if you have a history of bad breath or bleeding gums. However, there are some diagnostic measures which sometimes we do take to determine whether you really need the deep cleaning. For example, we can use radiographs, which are going to show progressive bone loss, whose end result, if not attended to, is tooth loss. Also, the X-ray might reveal some hard tartar buildup around your teeth. Another proper way to diagnose if you will really need the deep cleaning is also by doing gum measuring using periodontal probe. This usually we usually use it to check if there are pockets on your gum area. And these pockets, many times they become filled up with the tartar or some bacteria. So, full mouth scaling is usually done in 1 to 3 visits, depending with the presentation of your gums and your teeth. And it can be done using a hand scaler or an ultrasonic scaler, and the choice is dependent with your dentist. So on to our assumption number 1. Dental deep cleaning is painful. Honestly, this varies from one patient to another. It can be painful, especially if you have periodontal diseases and your gums happens to be swollen or inflamed in one way or another. If the procedure happens to be done without local anesthesia, then for sure you're going to experience some tenderness during the process. It can also be no, especially if you have a fair oral hygiene status or some mild extrinsic stains. However, the procedure might be a bit uncomfortable, especially on the lower anterior teeth, which are these ones. These teeth are usually small, though kwa model yangu zinakaa kubwa kidogo. But clinically, in most people, these teeth are usually small, and depending on their morphology and the nearness to the nerve area, it makes the cleaning around that area quite uncomfortable. And sijasema pain, I've said uncomfortable. Another assumption is that deep cleaning makes the teeth loose. No, deep cleaning does not entail the removal of the tooth attachment from the gum and the bone. However, if you have a lot of heavy tartar ama calculus, these tends to mask a large amount of bone loss. Hence, it gives the tooth a false impression of stability. Sasa wakati tutakuwa tunafanya the cleaning and get rid of all that tartar, we end up exposing the looseness which was already in existence, and sometimes we might subject the tooth to sensitivity. Not that it's the procedure that has caused, but it's because the problem was already there, but it was being masked up by these tartar. So another assumption is that deep cleaning damages the teeth. On the contrary, the purpose of the deep cleaning is to control damage to the teeth. However, if the procedure is not done by a skilled or untrained person, then they might cause tear or even remove some of the tooth structure. And this is going to subject your teeth to some discomfort in the near future. That being said, assuming the procedure has been done well, there are some take-homes your dentist or your oral health caregiver is going to tell you. For instance, when you get home, you rinse your mouth with warm salty water. The dentist might also prescribe for you some antibiotic or some analgesics, depending na vile your gums and your teeth were presenting in general. And they might also give you, in many circumstances, we also prescribe for you some mouthwash, which is going to control bacteria from getting into your gums, especially if you had the deep pockets. Also, after the cleaning, we usually advise you to get a new toothbrush. So once you do all that, trust me, you're going to have a good oral health status. And since it is our mission to form a good oral health squad right here on this channel, make an effort to visit your dentist, get the annual checkup done, and if the cleaning is advised and you are given an appointment, kindly make an effort of ensuring you avail yourself for the appointment because it is necessary. Hope you have learned something today. Let's meet in our next video. Bye bye.